Everyone, we'll get started in 2 minutes. Trinabh ji, will you be able to make Ajay a co-host?
Sure. Yes, Ethan. Yes, I made him.
Will you be able
Yes,
to make
yes.
Ajay a co-host?
Yes, can you hear me? Yes,
Yeah.
I already did.
Okay, I'm able to hear you.
Yes, Ethan. Yes, I made him. Yes, yes. Yes, can you hear me? Yes, I
Yes.
already did.
Okay, I'm able.
Hetalji, did you want me to do the housekeeping?
Yes, please, Amit ji.
Yep.
Yes.
Okay. So namaste, welcome to everyone. Thank you for joining our session today. Just a few quick housekeeping announcements. This is our third workshop of the series. We have an online presentation and a PowerPoint, so the best way to connect with us is over a laptop and not necessarily a cell phone. Just so that we respect the speakers and the demonstration, please make sure you are in a quiet spot or you mute your phones. At the same time, if you're able to, please stay away from your cell phone so you are able to give your full attention. Please plan to stay till the end of the workshop. And if you're attending the yoga demonstration, please have your mats and the props available as well. We have a couple more workshops coming up, one on July 11th, that's about science of food and yoga perspective. And then we'll also have another topic, genesis of fear and anxiety. We do not have a date yet, but we're setting up a date as soon as possible. So with that, I'll wait a couple minutes so people can join in, and then I'll introduce our speakers.
So we will not have a break between the talk and the yoga session. So if you want to go and grab your yoga mat and blocks and straps, you can have those handy as well.
So it's 3 o'clock, and we'll get started. Namaste. We're very fortunate to have two experts today to guide us on how yoga sadhana can be pursued safely, even with neck and back conditions. So I will introduce our first speaker. Dr. Joshi is originally from Massachusetts, attended Dartmouth College, followed by Harvard Medical School and orthopedic training in the Harvard Combined Orthopedic Residency Program. He went on to complete his formal medical training with a comprehensive spine surgery fellowship in the Department of Orthopedics at Baylor College of Medicine. Since 2004, Dr. Joshi has been providing spinal care to patients of all ages, pediatric and adult, in San Antonio, and now happily consider himself a South Texan. His spinal care practice is named South Texas Spinal Clinic. His related professional activities have included publishing results of local innovative early onset scoliosis care and teaching and lecturing locally and abroad. Within the spine surgery field, Dr. Joshi embraces advancements such as motion-preserving cervical disc replacement and minimally invasive techniques. Recently, his interest has grown in the areas of resiliency and lifestyle medicine. A recent diplomat of American Board of Lifestyle Medicine and member of the American College of Lifestyle Medicine, Dr. Joshi co-founded Hill Country Lifestyle Medicine Center in 2019. In this healthcare initiative, he's committed to promoting community and population health through organizational consulting. The objective is to help every individual reach his or her full potential through resilience building and education and guidance about natural and holistic healthcare options as patients deal with their various health issues. In his personal time, Dr. Joshi enjoys running, reading, progressing in his yoga practice, and spending time, especially outdoors, with his wonderful family, including his wife, 2 kids, and his dog. With this, I'll turn it over to Dr. Joshi.
Namaste, everyone, and good afternoon. It's a pleasure to be with you. I will get this talk loaded and shared, and then we'll begin. Can I just get a confirmation from Hetalji that with the thumbs up that my audio is just fine? Hearing, okay, very good, very good. So I am thrilled to be here, and really it's a pleasure. The content I hope will serve you very, very well. The introduction I really appreciate. This is yoga for spinal disorders. I would think of it as yoga for spinal health. Think about health promotion in general and disease prevention and disease reversal, not chasing specific spinal ailments. We will talk about specific spinal ailments for sure. The 2 affiliations that were mentioned, Hill Country Lifestyle Medicine Center is where I'm involved in population health. As mentioned, I'm based in San Antonio, neighbors with the Naiks, and so we're all trying to improve community health. So today's activity falls under population health to me, but my work as a spine surgeon is based at South Texas Spinal Clinic. And I just need to stand up a little bit so you can see my Yoga for Warriors t-shirt. That's one of the themes here in recent years from our wonderful local team on our International Day of Yoga. So we're all warriors in the era of stresses and pandemic and concerns and how to be good parents and kids to our aging parents and whatnot. So let's see. So I want to start with some important background. I think that yoga is best seen when we think about the lens through which we view it. And there may be physicians in this audience or other medical providers, whether you are in medicine or not, there's a lot to take away from this. But as someone who is a physician, I would say that modern Western medicine and my formal training is present in my thought processes. So trying to reconcile that with the yoga progression has been interesting. So looking at my progression is a lens onto the yoga itself. I am a musculoskeletal care provider. I provide spinal care for all ages, which is the care is sometimes surgical, but most often it is non-surgical. More and more over time, I've found that the vast majority of patients that come in, meaning those who do not need surgery, fall through the cracks when it comes to getting important content. And that content is shown on the second bullet point. They need to hear about stress management in particular these days, the connectedness of the mind and the body. So we're an integrated system. And then these various measures like weight reduction, core, sleep hygiene, diet, etc. And I will tell you, it is my opinion, we could certainly discuss, but a fee-for-service system, whether you're in academia or like myself in private practice, does not incentivize delivering this information. I think about too many silos. So in a silo model of care, you see subspecialists, and the subspecialists are focused on a narrow toolbox. There are incentives related to their professional activity and RVUs or productivity units, as well as ancillaries that may be present that incentivize using the tools in the toolbox. You see that in spinal care. If I show you these silos here and you look in the picture, here's spine surgery, neurology, pain management, rheumatology. So often someone might come in and a doctor might say, well, you don't need a spine surgery, so I don't really need to see you. So then that person might go to a pain management program. They might get a narcotic or non-narcotic based regimen. They might end up seeing if they're a candidate for a rheumatologic treatment. The neurologist might evaluate them. These behaviors are not malicious or unethical. They're just an implicit bias in the system. And so I don't think that there's anyone in that array of healthcare players who is really positioned to tell someone about the mind and the body as an integrated whole and take care of them as such. If you take the cardiology example, it would be the endocrinologist who's putting someone on their sugar medicines. The blood pressure medicines are coming from the medical doctor or the cardiologist. And then you have the vascular surgeon watching people maybe developing ulcers or issues with blood flow in their legs. So these are interesting scenarios that don't lead to health. They lead to chasing and managing chronic disease. My journey was I appreciate the introduction. Again, it's summarized again here. So traditional training, including medical school, orthopedic surgery residency, and spinal fellowship. So I've been in practice from 2004 to present, 16 years in, plenty of time to have some insights and revelations. And again, as I thought about what are we really doing, not an existential crisis, but really questioning, are we doing something of value for people? So in the last 2-3 years, it's become very compelling to say, let's look at that holistic integrated message, the way people can unlock their own healing and self-care potential to be their best selves. So whether you're a physician or not in this group, in this talk, I recommend that you check out American College of Lifestyle Medicine, because while the yogic scheme is very powerful, this is another way to talk to people about these self-care tools. So I joined that organization. Subsequently, I studied for and earned training or status as a diplomate or a board certified member of the American Board of Lifestyle Medicine. And I was very fortunate to go through training last fall from San Antonio. I did it virtually, SMART training. So SMART is stress management and resiliency training based out of Massachusetts General Hospital. The messages there were not just about resiliency, but about diet, sleep, exercise. So many different systems are trying to accomplish the same goals of unlocking self-care and helping people find their best selves through their own potential. I was also interested at one point in progressing towards becoming certified as a yoga teacher. And that goal may be certainly worthwhile to pursue in the future, but the reality of constraints and schedule means that the smaller victory within that journey is that I've at least gotten much more regular in my practice with the help of my collaborator, who's my sophomore to be in high school daughter. And this time of COVID has led to a lot of time to get more regular in the practice, which I hope continues. So these are all important tools that I mentioned for helping myself and for helping patients. And so you might ask, well, I thought we were going to hear about spinal problems, and we will shortly, but I think the context of all this is incredibly important. So why do I bring this up? Where and how we live and an awareness of society's healthcare tools and approaches to problems is crucial to understanding yoga and its power, believe it or not. So most current tools in healthcare systems involve managing disease, responding to problems. Often these are external solutions that are patches. So I've seen plenty of patients, even though I don't take care of blood pressure and diabetic problems primarily, they're on 2 or 3 blood pressure medicines, 2 or 3 diabetic medicines. People have surgeries of various sorts, which may not be crucial when you look at, were there alternatives? Did we miss something along the way? So I think of an essential or unavoidable surgery like fixing the broken bone if you had a car crash and you sustained trauma, or you have a ruptured appendix that needs to come out. So these systems emphasize these external solutions, and they will neither see an integrated whole person nor help unlock our vast power of self-care. So yoga, on the other hand, does much more than this if you embrace it fully or to the extent that you can. And we know to varying levels, based on how immersed or how much we've studied, that yoga is much more than the asanas. And I know many of you have studied in detail, and so you're obviously well aware of this. So I would like to map the features of yoga and compare and contrast to ACLM, or American College of Lifestyle Medicine's notion of lifestyle as medicine and the 6 pillars of that. So we will get into all the aspects of the physical state of neck pain and low back pain and yoga to address that. But first, I want to, before we get into that granular level, I want to look at this because I think it's very important. So these are incredibly important. So we start with this. There are 4 bhavas or underpinnings for the sake of this conversation, and you see them lit on the screen: dharma, jnana, vairagya, and aishwarya. And you see how they are, what they mean afterwards, or listed afterwards. The last in particular, aishwarya, or self-reliance, is incredibly important, and it leads us to this notion of self-care. So all of those areas in yoga are important principles to allow us to find our best selves. But if you now look at this screen and you see 4 underpinnings within the yogic lifestyle: ahara, achara, vihara, and vichara, and how they translate into diet, routine, recreation, and thoughts. And then you look at the 6 pillars of lifestyle as medicine, the 6 pillars of health. 5 are listed below in the red boxes: diet, sleep, exercise, resiliency building or stress management, and connectedness or positive psychology. The 6th one is below: avoid risky substances. You can see how these concepts map to each other, okay? So diet, of course, sleep and exercise as having a regular routine. and so on. And avoid risky substances is similarly able to map to routine. So for me, I reconcile this as learning about the complete yogic pathway is really consistent with what I've been learning in an area like lifestyle as medicine through ACLM. And that's very rewarding, important, and satisfying. It's one consistent message. It's not people feeling different parts of that elephant up there saying, well, I think it's this and I think it's that. It's all the same thing. So we're looking for disease reversal, prevention, and not just patches. Yoga and Ayurveda give a comprehensive roadmap for wellness. We will look at specific spinal problems and the asanas that can help with specific disorders and problems, but be aware of the larger messages of self-awareness, self-care, and right living. So for many people, they might say, I get the understanding in this or that form. Again, there may be ways that sleep hygiene is broken down in the ACLM framework. There may be ways that mindfulness is explained through the SMART program. Yoga offers everything. Sometimes it can feel a little nebulous. I think it requires more study to become more concrete. So just reflect as we keep talking. How aware am I of my health habits, my level of stress, and the level of self-care I'm currently practicing? This may be a very self-selecting group, and the answer may be, I'm very aware, and that's great then, well done. And we keep trying to progress, each one of us. So how is my diet? How flexible am I? If you're already somewhere along the pathway, that's great. You may have an opportunity to nudge that next person, whether it's your patient, your neighbor, your colleague, whoever, so that they can start having those awakenings too. So we will talk now about spinal anatomy and function details. The spine has 3 sections, but actually it has more than that. So you see the yellow, green, and blue areas, which are cervical, thoracic, and lumbar. And then down below is the purple area, which is the sacrum, which we shouldn't ignore. The sacrum is actually both the keystone or centerpiece of the pelvis, but it's also the base of the spine, and the lumbosacral junction is very important. The thoracic section, because of a variety of factors, including anatomy of the ribs and the anatomy of the bones, is less mobile. So there's more motion in the cervical and lumbar areas. There is plenty of motion possible in the thoracic spine, but slightly less. As far as function, the spine is an anchor for the upper and lower limbs. It keeps us upright, and it's a conduit for the spinal cord. It's powered by muscles, stabilized by muscles, and control of those muscles is both voluntary and often subconscious through the nervous system. I think it's much more useful. We can talk about the spine, but we ought to be talking as a functional unit about the core. So if you look at the bottom right picture, what do you see? Not much. The spine is the corner of the room, but the whole room matters. So that may be small on your screen, but that vertical writing just says spine. So the rib cage, the muscles in the front, in the back, on the inside, like the psoas, these are all very important. If you look at the circle on the center before and after, very nice health progression for that individual. And then you look at this load of bricks landing on that tray. So let's look at that lady on the far left. If she's going to hold that tray of bricks in front of her for a long time, you can imagine what happens to her arms and her shoulders and her back. So I will leave it to you to imagine what happens when the front of your core or your torso is carrying the extra weight that you see here in the circle when you go back to the middle picture. We see again that the core is the stabilizer of the limbs. So bottom right photo, this runner, you want to contract your muscle and have your core be stable so that that leg can advance efficiently in front of you to run efficiently. You want your core to be strong so that when you turn the steering wheel turns because you turned it, not the other way around, that you got turned by the steering wheel. And the core being strong allows your arms to work efficiently. You see some core muscles in this diagram here in the middle. There's numerous ones. Again, there's ones that are inside that are hard to show, but the psoas lives on the side of the spine and the inside of the pelvis, crosses through the pelvis to the inside of the femur. So this is the thigh bone or femur right here. The hip, the psoas attaches to the lesser trochanter and is a external rotator as well as a flexor, primary flexor of the hip joint, and very important for the core and the back. Common spinal conditions are shown here. Strain is a soft tissue condition. Spondylosis, be it cervical or lumbar, is an arthritis change. It's just the term for arthritis in the spine specifically. Stenosis is narrowing of spaces that, generically, stenosis is narrowing of any space. So in cardiology, we would think about coronary artery stenosis. That's obviously not the focus today. But when you have nerves in spaces and bone spurs develop because of arthritis in the spine, structures like bone spurs or disc bulges can encroach into spaces where nerves live, leading to narrowing, and that is stenosis by definition. The clinical correlation can vary, and that means that that individual might not feel anything. That individual might feel axial pain, axial meaning located at the spine, or they might feel a radiating pain into the arm or the leg. So the symptoms can vary. Cervical stenosis, because of the spinal cord being very delicate and having a finite amount of room around it, cervical stenosis can lead to cord compression and myelopathy, which we will look at. Lumbar stenosis can lead to symptoms of pain and numbness and tingling, but rarely a situation of weakness or crisis of bowel and bladder function and stability and gait. Again, stenosis can lead to axial or radiating symptoms or no symptoms. Kyphosis is both the term for the normal curvature in the spine, in the thoracic area when viewed from the side, or the notion that we as a whole are too pitched forward. We're not able to stand up fully straight, and this can lead to balance changes. And a later slide will show this in detail. Fractures can happen. These are not as common as some of the other conditions, but are common enough to mention. So we should monitor bone density for women before and after menopause, when bone loss can be accelerated, for men as well as they get older into the geriatric decades, to make sure we're not seeing tremendous bone loss, because it can be reversed and addressed. Part of the way to address it is to emphasize low impact activities and to optimize calcium and vitamin D intake. So here we take a closer look at strain and spondylosis. This cartoon on the left is just meant to say that strain is really a soft tissue problem. It generates and manifests itself as pain. You look at the right image, and that is a top-down view of a vertebra or a bone in the spinal column. And you can see here on the periphery bone spurs. You can see a disc herniation here encroaching into where the nerve lives, so there is stenosis. This facet joint, which is on the back side, so the back of this person is towards the top of the screen. The facet joint is arthritic, so that's a spondylosis or arthritic change. And spondylosis, by virtue of things developing like spurs and disc herniations, spondylosis can be closely associated with stenosis, where you see this in the middle picture, and that is that the space for the nerves is decreased or encroached upon. There's less room in these areas than there is up higher. So we look at stenosis. Stenosis I've been over just now, which is a narrowing of a space. If you look at this herniation, it leads to less space for this nerve traveling through this exit in the spine. than this nerve on this side. So that is stenosis, which can have varying clinical correlations, as I mentioned earlier. No symptoms, axial symptoms, radicular symptoms. And here you see stenosis from the side. So the nerve exiting is being bothered. This nerve is just fine. And here's kyphosis. So the rule of thumb is that a gravity line from the bottom of your neck or cervical spine downward to the floor, just a plumb line, should fall within 4 centimeters of your sacrum on a side view. This one would fall a lot further forward because of excessive thoracic kyphosis. And we'll look at why kyphosis develops and maybe what we can do about it. Very exciting that we can do something proactive. And then here's fractures just to illustrate. Think of each bone as a soda can that, you know, I'm sure everyone at some point may have stepped on a soda can to crunch it down. And so here's a reduced in height soda can. Here's a normal one. So this is a fracture. And while you could walk on this, unlike a fractured hip, it can be just as painful. Fractures can lead to more fractures. There's a significant mortality rate 1 year after sustaining a vertebral fracture. So there are significant health consequences. Common spinal symptoms are shown here. So pain, numbness, tingling, weakness, imbalance, rarely bowel and bladder issues. Unless the situation involves tumor or infection or spinal cord compression, or structural or neurologic instability, which I won't get into details defining here, most of the time, conservative care is very appropriate. Self-care in all of those areas that yoga offers us, or physical therapy, yoga strategies, these can help significantly. And I will say that I've talked to you about these specific conditions and we will go over them, but the final common pathway is pain, right? So when your body experiences pain, it's unclear if it's arthritis or if it's a strain. There's not a unique symptom for each of those. And in the end, we just want to do the right things. And fortunately, those treatments, asanas and other measures often overlap. So it's unlikely that that pain represents tumor, infection, spinal cord compression, fracture. So in that case, we say, hey, let's proceed with the usual strategies that we will go over. It's important to note pain sometimes has no anatomic correlate. I see people that have bad pain. I acknowledge it as real. I reassure them that we're not missing something structural. An MRI might look fantastically normal. And just like that person who has headaches, and that person experiences the worst pain imaginable, and we validate them. We say your migraines are debilitating. We should take pain seriously. We should emphasize holistic self-care, be it pranayama, other forms of mindfulness and meditation, hydration, physical practices like asanas. We should recognize that pain can be a very challenging problem. So cervical strain, I'll cover lumbar strain separately later. Cervical strain is a soft tissue or myofascial problem. It is common. It is sometimes traumatic, but I think far and away it is due to accrued stress to our spine from postural, behavioral, and occupational risk factors. And that is that student who's sitting in front of the computer for hours and hours. It's that IT person who's doing the same. It's laying in bed with an iPad and not really being good about posture. So there's a lot of behavioral and environmental risk that goes into this, and that can lead to muscles getting irritated. There is a traumatic mechanism shown in the top right that also happens. So some of the asanas that are very helpful are shown here. We will get into them later during the practical experiential portion, but really the recipe is doing these asanas regularly, taking breaks at work, avoiding prolonged screen time, and the other aspects of yogic living, like stress management, hydration, and so on. Cervical myelopathy, I illustrate here. It is not a common thing, but if you or anyone you know or someone you're treating, if you're in that position, is experiencing clumsiness, numbness, gait changes. It could be, this is an illustration here of an MRI from the left side. This person is facing to your and my left. The spinal cord is this gray stripe. In the white spinal fluid, the cerebrospinal fluid, and that's the base of the brain at the very top. While there's abundant space here and here, there's not enough space here because of multifactorial issues. Disc bulges and the structures in the back of the spinal canal are bulging inward. So this really needs medical care, and I think most people would recognize that. I think everyone would recognize that. Okay, cervical radiculopathy. Radiculopathy means nerve involvement, probably from stenosis, like you see here in the bottom picture, bottom left axial view, like top-down view, and then radiating symptoms. So if you go to the top right view, these are the different stripes of dermatomes that different nerves cover. So you see how C5 looks different than C8. Radiating symptoms are often because these nerves are under some pressure. And in the absence of spinal cord pressure, treatments can be very successful conservatively or non-surgically, and they are as shown. Sometimes traction in mild flexion can help. Flexion because the exit hole that the nerve is running through can be opened a little bit in flexion as compared to extension. That's the same rationale for sleeping with a slightly taller pillow. Soft collar medicines. Cervical spondylosis is basically the generic condition of arthritis or neck pain. And in an acute flare, this recipe is shown for traction, medicines, heat, relative rest, and some very reasonable, helpful asanas shown, including Shavasana, Nishpanda Bhava, and Dradasana. When symptoms settle and we're in a phase of, I'm trying to hold off, I'm trying to stay a step ahead of any trouble and really maintain the body and optimize the body, this is a list of poses, asanas that can be very helpful. They are shown on the right. I did not label them because we will be getting into this in a more practical, experiential way later. A summation for the neck is as follows. Neck pain may or may not have arm pain or numbness or tingling. It may be a strain versus spondylosis flare. Your body doesn't know the difference, and practically speaking, I don't think it matters. You want to practice strategies, stretching, self-care, asanas that will promote getting better. And then if you're in a maintenance or thriving phase, you're not having issues, you're just building your practice to stay a step ahead and to minimize the risk of issues in the future. We turn to scoliosis. Scoliosis affects 3% of the population. Often there are no symptoms early. You see an X-ray at the top right. You see that conceptually it is that there's a curvature in the front, when viewed from the back or the front, there's a curvature. We should look straight in our spine from those views. And there are various curve types. Reasons for this are complex, but the overwhelming majority are just because, or idiopathic. Like someday we'll be able to explain it on a genetic basis, but not right now. So some of us have dimples and freckles, and we have the fingerprint pattern that we have, but we don't know exactly why. And it's not critical to know why. So we do have a functional way to think of scoliosis, and that traditionally has been smaller curves can be watched with, of course, also a recommendation for physical therapy. Curves that are progressing in skeletally immature youngsters can be braced, and in addition, physical therapy, and then larger curves are treated with surgery. A very interesting paper from 2014 called attention to the fact that side-lying plank in a small group of people a small group of patients, about 25, 30 patients in one group were braced for progressive scoliosis, which is the standard treatment. But another group was not only braced, but they were specifically taught to do side-lying plank. So when they did that, the number of youngsters progressing their curve was decreased in the side-lying plank group, and the overall curve magnitude tended to be less, even when the two groups were similar to start. Not robust numbers like 1,000 in this group and 1,000 in that group, but a reasonable suggestion that the core is very important, and we can play with some variables in addition to the external measure of bracing, and that is the internal measure of keeping our core strong. So those asanas are shown here. Turning to back pain. This is a potentially overwhelming list on the left side. All I mean by listing all of this is that back pain often has nothing to do with the core and the structural spine. And you can see that from the bottom diagnoses, the bottom three, including neoplasm of various sorts, GYN issues, and renal disease. Now, the takeaway when you look on the right is that there are diverse causes. Many times it's not a direct spinal reason, and we try to optimize variables, which are shown, and we've been referring to those. So low back pain, however, does have some common spinal causes. And just like cervical, in the lumbar spine, you can see strain, spondylosis, and then kyphosis and fracture are more relevant to this part of the spinal column, lower down. So lumbar strain, again, an acute phase has certain strategies. The relevant asanas are shown here. In addition, heat. Some people come into my practice and they're very interested in an inversion table. Anecdotally, they feel like it helps. It's a form of traction. I have no problem with that. Relative rest, we don't prescribe days and days of bed rest, but relative rest, and then medicines as needed. A soft tissue or myofascial problem. Other times, when we're just well and we want to stay well and really have our body be at its best, there are numerous practices and asanas that can work towards that. And I think I would say that it's a combination of psoas, stretching, strengthening, posterior muscles, the joints of the spine, their flexibility, anterior muscles or front muscles. So it's a very diverse strategy that when you integrate it with these various asanas, you get a complete program for core and spinal health. Sagittal balance is an interesting issue. All I mean by the term sagittal balance is that our sense of being upright can change over time. And there are thoracic reasons and there are lumbar reasons. So you look at this cartoon on the left, and this woman over decades is changing as she's getting more kyphosis in her thoracic spine. Now, that can frequently be because of fractures that either caused symptoms or didn't cause symptoms. But again, you remember that soda can, it gets crunched down. You see it in the MRI here. So this bone looks shorter than its neighbors here and here. And so there's more kyphosis. And that can become challenging to overcome. So we need to pay attention to bone density for people that are medical providers, or any one of you. If you're getting to be 50 and above, you might be losing height simply because discs are wearing out. But if you see someone older in your family who's getting shorter, and whether they hurt or not, it may be worth asking, when's the last time you had a bone density? Have you had an x-ray of your spine? It's worth knowing. It's important. We can't do anything if we don't bother to think about it and ask. The lumbar reasons for changing in your uprightness have to do with these discs and cushions wearing out. So it is an exception to the yogic stamp of approval that I included this stack of Oreo cookies, because I couldn't resist. Who does not like an Oreo cookie once in a while? So the Oreo cookies are here, and we have cream filling in the middle. The cream filling is the discs in the lumbar spine. The discs are the cushions between the bones. Here's a stack of just the wafers. So you got the cream filling here, but you don't have it here. The stack got shorter by the height of the discs in aggregate. And there are people that wear out these discs. And you can see this x-ray on the far right is a patient that I treated, and he has bone on bone, bone on bone, bone on bone at multiple levels. When you drop the gravity line from the base of his neck, it falls well in front of the back of the tailbone. And he felt it. I hurt, I can't fully stand up straight. So, an interesting question and one more compelling reason to do yoga from early, these asanas, and to commit to the whole lifestyle is, my question for all of us is, could greater flexibility and muscle activation from years of Surya Namaskar, for example, counter a loss of lumbar lordosis because you're pulling on the backside of the spine and you're saying, we're going to help unload the discs in the front. So could yoga be preventive and a treatment for kyphosis? It would be hard to study because you would be asking a group of people starting at 20 to do it regularly and to follow them 50 years later, while you followed a separate group 50 years later that didn't commit to the extension exercises. Regardless, if you are kyphotic or just happen to be aging, which welcome to the club, then what if hip mobility, including extension exercises, stretching the psoas, keeping the back extensors like the multifidus and many others strong, could that help counter kyphosis so it would never set in, even if your discs want to wear out? Discs want to wear out just like your car and bicycle tire tread wants to wear out. They're finite materials with finite durability. But maybe not. Maybe we can stack the deck in the favor of them by the ideal weight, the strong core, the proper sleep, the lack of inflammatory inputs like sugars. So we should practice. We should practice extension-based exercises, and you see a great one right here. Lumbar spondylosis, very similar to the notion of the strain situation. So acute phase and then maintenance or I'm not struggling phase. Your body doesn't know if it's strain or spondylosis. It just expresses ouch, and you need to be equipped to manage that phase. So in the maintenance and thriving phase and acute symptomatic phase, the strategies differ a little bit. Acute phase is shown here, medicines, relative rest. These asanas, maybe traction, inversion, and heat. And then in the I'm well, I'm just trying to be strong and flexible and really, really stay ahead of trouble, here's the extensive various strategies that address various parts of the core and the spine that can be helpful. Lumbar stenosis and radiculopathy. I will say that stenosis has an interesting phenomenon where leaning forward opens up the spinal canal. So people with stenosis who will come into my spinal practice saying, I really feel better and I can walk farther in the grocery store if I lean on the shopping cart. It decreases the pressure on the nerves and the neurogenic claudication, the burning in their legs. So when people have stenosis, if that diagnosis is known, asanas that help include ones that are emphasizing a forward flexion, and I would say, relatively speaking, to de-emphasize the ones that are about extra extension. I'll just mention, again, it's very personal. We all learn from each other, from one another. My routine has grown. I enjoy different things for athletic goals, for stamina, for participation in races, for camaraderie. The camaraderie might be with a friend, it might be with my daughter, it might be with my son with whom I run. So various things with various people. I've run in half marathons consistently in the last few years, ran a couple of marathons a long, long time ago. I don't think I can do that again. So I have gotten into a more regular yoga routine with my yoga buddy, in the COVID era, and I hope to continue that, we do Surya Namaskar and then a variety of other asanas. But my daughter also found a couple of other personalities and fitness people that she connected with in terms of their style and their content. And so we do that as well. The point is variety can be good. So some people like Peloton. I like to run as well. Cross training makes it interesting. You start where you are. So we all know that there are people that are very accomplished with their practice. We are all trying to progress. It's not a competition or a comparison. I think probably you know that. I just think it's healthy to say that. And you find and define your preferred mix. So in conclusion, I would like to thank Hitalji for her very kind invitation to participate. I will tell you that this book that is shown here is available and was a great resource for much of the information in this talk, not necessarily concepts about kyphosis and sagittal balance, but the asanas that can help with various spinal conditions. There was I paused during the talk because I thought I saw an error message. It turns out it was a chat box request to post the talk, and I'm very happy to share this talk. And this is my email at the Hill Country Lifestyle Medicine practice if there are questions. And I would just tell you in the way of an official disclaimer, disclosures on my part, there's nothing to disclose. And this is an educational talk. Obviously, don't take it as medical advice. And here are a couple of links I would strongly recommend. They're very interesting and informative. I understand that at the end of our practical session, we will have time for questions, and I welcome that. So thank you for your attention.
Thank you, Ajayaji. That was very helpful. And that book that you shared was very resourceful. I bought one copy. I started my yoga journey from that institute in Santa Cruz. My first book that I referred to was from there. And recently when we went to India, we got to visit that institute. So very useful and resourceful book for back pain and joint pain.
Can you hear me? Okay. Dr. Hital Naik is an anesthesiologist by training from the Albert Einstein School of Medicine. She's been practicing and teaching yoga since 2008. Dr. Naik has trained under several yoga gurus from around the world. She's currently pursuing her studies in Vedanta and is a student of Nilofer G. Giri, who is a disciple of Swami Dayananda Saraswati. She's also been initiated on the path of Kriya Yoga by an ordained Himalayan monk, Swami Vidyashananda. She has been teaching yoga to kids, teenagers, adults, and older adults. Her students range from age 4 years old to 82 years old. Dr. Naik is a founding member of I Do Yoga, a community project of Seva International, a 501c nonprofit, which uses a platform of International Day of Yoga to bring yoga to all walks of life and to the underserved population in the city of San Antonio. For details on this project, please visit idoyogasa.org. Dr. Naik is also director of Om Yoga Sadhana School. She's serving to bring yoga to the Indian community in San Antonio and training yoga quality teachers who can carry on the mission of enhancing life through the practices of yoga. She lives in San Antonio with husband Dr. Devraj Naik and her 2 daughters. Ketalji.
Okay. So before we start our yoga practice, I have about 10 minutes of presentation as well. And then we'll get started for a 45 minutes yoga practice. Okay. So yoga as a therapy. This is one of my favorite quotes when it comes to yoga therapy from Einstein. A problem has to be solved at a much deeper or a higher level than it appears at. So in yoga, like Dr. Ajay Joshi shared, we have also the toolbox. The toolbox we have is dealing at all of the 5 levels or so-called panchakoshas at the physical level, physiological level, at the mind, intellect, and the spirit. Prevalence of back pain, at 80% of us during some time of our life will experience some kind of back pain or the other. So it's a huge burden. That's the 5th leading cause why anybody sees a physician, and billions of dollars are spent. Also, billions of dollars are lost when we are not able to continue with our activities when we experience pain. So like Ajay Aji covered, this was our first workshop in the series, and we had gone over in detail on Ahar, Vihar, Achar, and Vichar. So yoga is a lifestyle, it's not just asanas, and cannot stress enough how each of these components are important. Ahar is the food, anything that we take in through our senses. Vihar is the activities that we do for recreation. Achar is our conduct with ourselves and also with the world outside us. And Vichar is our mindset. So prevention is the password for healthy living. Yoga, like I always say, from size 0 to moksha, enlightenment. It has everything for us to give us. It depends on us how much we want to grab from it. So prevention is best, but if we are at the stage where we are already experiencing some kind of morbidity or pain, one of the principles also in the philosophy of yoga is titiksha or fortitude, to accept what we cannot change. And with this acceptance, there comes some kind of inner peace, which gives us courage to live the dharmic life that Ajay Joshi also stressed on, which then leads for us to follow the foundation of yoga, which is yam and niyam, the do's and don'ts of yoga. So muscle harmony is crucial, and that will be our focus during the practice today. The muscles are the main shock absorbers of our body. They deload the joint, and muscle harmony is very important. So not only strength, but when we just do the physical aspect of yoga, the strength, flexibility, endurance, and balance, all of these 4 components come into place, and we experience the muscle harmony that is needed for the optimal work of our joints. So wrong posture has become a way of life. We went through that presentation, muscular disharmony, overuse of furniture. Pretty much 8 to 10 hours is spent sitting on the chair or couch or driving, or the kids also spend numerous hours in schools sitting on the desk or benches or chairs. So this can change if we just bring a little bit awareness in our posture, and if we try to sit more on the floor, whether we are eating or whether we are working on the computer or whatever we are doing. If the computer can be at the eye level, if your hips can be higher than the knees, this goes in a long way in terms of helping us with the posture. Again, obesity, we went over that presentation earlier. This puts excess of load on the spine, the knees, and all of the joints, and leads to poor abdominal tone, excessive concavity of the lower back, or so-called as lordosis of the back, and abnormal loading of the muscles. So preconceived notions and misconceptions: person with back pain must never do bend forward. That is a misconception. Forward bending should be restricted only during the acute phase of disc prolapse. But forward bending muscles are the biggest shock absorbers of the spine. In fact, the forward bending muscles are the core muscles. If we have those muscles strong, especially the transverse abdominis, which is a band that runs around the whole of the lower lumbar spine, then that can actually support our spine. Person with back problems should sleep on hard bed. That's a misconception. The bed should be firm and yet soft. Person with cervical spondylosis should not use a pillow. That is, again, a misconception. We can use one pillow as long as we are not hunching our back or putting 2 or 3 pillows under our neck. That should be avoided. Prolonged use of lumbosacral belt and cervical collar belts help the problem. Again, that's a misconception. During the acute phases, yes, you can use them, but chronically, if we use them, that can lead to the weakness of our muscles around the back and the neck. Massaging can provide relief. That's another misconception. Excessive care and caution. Well, some care and caution is required, but not to be overburdened by it or not to give too much thought to it and get stressed out about it. Self-medication is not a good idea. To consult an expert when you have neck or back pain is a first thing we should all be doing. So when we do these yoga asanas, it's like flossing the nerves through the body. So what we'll be doing today is we'll start with some of the movements for the neck and the shoulder, and then progressively cover these areas, the abdominal muscles, which is, we'll go through that in the next slide, the back muscles, pelvic floor, and diaphragm. All of these muscles are extremely important to keep our spine healthy, both the cervical and the lumbar spine. The asana sequence, today what we have designed is keeping these things in mind, that the hamstrings, which is the back of our thigh muscles, are very tight because of our modern lifestyle. So all the asanas that we'll be doing will be focusing on one or the other aspect of this: stretching the hamstring, strengthening the front of the thigh or the quadricep, strengthening the gluteus medius. The iliopsoas, which is the deep core muscle, needs to be stretched and strengthened. So all of the asanas, the combination of the forward and the back bends does that. Core strengthening, which is the transverse abdominis and erector spine. The pelvic floor harmony and diaphragm harmony. This comes with the pranayama practice and also with the use of bandhas. So majority of the back pain are non-specific and only 15% are structural. So what we'll be doing today, the asana practice, is more so for these non-specific back pains. Again, they can be divided into acute, subacute, and chronic. So like we went through the presentation earlier, the asanas that we'll be practicing today are not for acute or subacute conditions, but they're more so for chronic conditions and also for prevention of back and neck pain. How does yoga work? Increase in physical activity, increase in body awareness. The second point is the most fundamental of all of the yogic practices, starting from the asana, pranayama, and dhyana. What we are doing through the asana practice is increasing our awareness. So when we do that on the mat, that awareness then carries on to the other activities that we do throughout our day. Reduced maladaptive movements, correction of postural strain, relief of stress through the pranayama and dhyana practices, increase in pain tolerance. In fact, they have done the studies in which they have shown that there is increase in cortical gray matter in people who practice yoga for long years, and they are able to tolerate pain much better than a person who would otherwise not be practicing yoga. Also, there are studies that have shown there is increase in the GABA hormone, and that also helps with chronic pain and depression. So yoga is 99% practice, 1% theory. And so we should get our practice started. The method that we use in Ashtanga is called the Three-sthana method, which is 3 important foundation for our yogic practices. The first is the Ujjayi breath, or breathing with sound using the throat muscles, which brings in relaxation response. Second is the asana with bandhas. Bandhas, there are important 3 bandhas in yoga asanas. The Mula bandha, which is to activate the pelvic floor. Uddiyana bandha, which is to activate the transverse abdominis or the lower abdominal muscles, pulling them in and up. And the Jalandhara bandha. So these bandhas are also considered as co-activation of opposite group of muscles. Jalandhara bandha is when you bring the chin to the chest. It can be done in both the ways, the ha and the tha, which is constrictive and expansive, Jalandhara bandha, Uddiyana bandha, and Mula bandha. So throughout the practice, I'll explain and go into depths of these. For now, you just understand that when you co-activate the opposite group of muscles, it creates bandha. When you co-activate the opposite group of muscles around the spine, those are called as the Jalandhara bandha, Uddiyana bandha, and Mula bandha. But bandhas are around all of the joints. So that is the principle we use in the asana practice. Also, there is something called as drishti, which is the gazing point, so that you can maintain the focus during the practice. So not recommended to do the asana practice when you have music on or something that is distracting, but to completely be aware in the asana practice, what you're doing with your joints, with your breath, and where is your gazing point. So that is the Three-sthana method. So behind every patient is a potential yogi. So hopefully we start the asana practice for the ailment that we currently are dealing with, but not stop there, but dive deep into the ocean of yoga. So we can fully gain what yoga has to offer us. So having said that, we'll start the asana practice. It's 4 o'clock. We have 45 minutes. I have Devrajji here in the center, and Arya is here in this other side in blue t-shirt, and my mother-in-law as well. So wanted to share a story as how yoga has helped each one of them. My mother-in-law, she's now 70. She started practicing yoga about 15 years or so back. And about 25 years back, she had her first slip disc or prolapse of L5-S1 disc. She was admitted in the hospital and was hospitalized almost for a week, was on traction, and then later yoga came in her life and she started practicing yoga at much later in her life. But yesterday when I mentioned to her that today is a talk and workshop on yoga for back pain, she said that it's guaranteed that yoga can take care of back pain. So she had L5-S1 prolapse about 25 years back. And then about 10 years back, she was on the treadmill and she had a fall. And then she had a prolapse of L2, L3, L3, L4, and L4, L5. And even after that, she continued her asana practice. She's completely back pain free. She can do all the forward bends, back bends. In fact, I was asking her if her yoga teacher had particular asanas that she taught her. She said she told me to do all the asanas. There was no special class given to her. She did forward bends, back bends, and twisting in all of the poses done in the regular class. Arya is recently diagnosed of scoliosis. We diagnosed that during her asana practice. She was doing down dog, and during her down dog, I realized that one part of the body the back is asymmetric, and that's when we took her to Ajaya Ji, and he diagnosed her scoliosis, and she continues her asana practice now more diligently than before and with more awareness. Even though she's only 15, we encourage her to bring that awareness in her asana practice. My father-in-law is back there sitting and watching. He's 80 years old. He does 2 hours of asana practice every single day. Nobody has taught him. He learned from my mother-in-law. I'm trying to see if I can correct whatever things that he did not do right, because I'm slowly seeing kyphosis, and Ajay ji brought more attention to kyphosis. So I thought that's something that I definitely learned from today's talk, which I should bring more awareness to in his practice. So having said that, let's come to the mat. Use a block to sit on if you have one. It helps to maintain the normal curvature of the spine. Keep your hips, your back, neck, and head in one straight line and sit nice and tall. Inhale, connect with your breath. Take a nice deep breath in, lift the heart up. Exhale, maintain your height and maintain the natural curvature of your spine. Bring the hands at the heart center. We'll start with the invocation. This is the invocation to Patanjali. Yogena chittasya padena vacha manam sharirasya cha vaidyakena yopakarotam pravaram munina patanjalim pranjaliranatosmi Abahu Purushakaram Shankha Chakrasidharinam Sahasra Shirsam Shvetam Pranamami Patanjalim Hari Om. Bring the hands down to the knees. We'll start with the neck movements. These neck movements really help us relieve the stress and the strain around the neck. So we'll do the movements with a lot of awareness. Drop your chin to the chest. Every time you drop your head down, push your neck up and back. Activate the front and the back of your neck muscles. Inhale, take a deep breath. Drop your head back, lift the chest and neck forward and up. Coordinate your movements with the breath. Exhale, bring the chin to the chest. Inhale, deep breath, look up, keep the body relaxed. Exhale, drop your chin to the chest. Bring your head back to the center. Inhale, look to the right. Exhale, back to the center. Inhale, look to the left. Exhale, back to the center. Inhale, bring the right ear to the right shoulder. Maybe take the right hand to the left ear. Gently pull the neck, drop the chin to the chest, and then turn your head, look to the left. Relax your face, focus on your breath, nice deep breathing. Maintain the lift from your heart, maintain the normal curvature of the spine. Release and bring the hand down. Now bring the left ear to the left shoulder. Take the left hand to the right ear, drop your chin to the chest, and then turn your head to look to the right and up. Stay there, focus on your breath. Give a nice stretch to the right side of your neck. Traction the spine as you do that. Release and relax. Now drop your chin to the chest. We'll do the head rotations. As you inhale, bring the chin to the left and look up. As you exhale, slowly bring the head to the right and down. Inhaling, slowly look up. Exhaling, bring your chin down to the chest. One last round. Inhale, look up. Exhale, bring the chin to the chest. Now do it in the opposite direction. Inhaling, go up. Exhaling, come down. So do that at your own pace, within your own limits. Do it 3 times. And then when you're done, bring it back to the center and relax. Now reach with your arms, create a lot of space. Always the shoulders are away from the ears. Reach out from your shoulder blades. Create a lot of space in your shoulder and free your neck up. Push the base of your hand, extend the wrist and push it out. Lift the heart up, traction the spine. And release and bring it down. Bring your hands to the shoulders, do the elbow rotations in few times. And then out few times. Okay, then interlace your hands, press the palms out and flex your upper back. Flex the spine, protract the shoulder blade, bring the shoulders away from your ears and open your upper back. Engage your pelvic floor, that's the Mula Bandha, which means gently lift the pelvic floor in and up. Release. Interlace your hands in the back, lift the heart up, open the spine. If you can, look up, drop your head back and extend the whole of the spine. Create nice traction, create space between your vertebrae. If looking up is too much, just look straight ahead. When you're done, come back to the center and release. Reach with your arms again. Take the right arm over the left. Again, protract your shoulder blade. Create a lot of space. Shoulders away from your ears. Separate the shoulder blades and round your upper back. Release and switch the side. Take the left arm over the right. Bring the palms together. If that's not possible, bring the hands, back of the hands together. And then again, separate the shoulder blades and give a nice stretch between your shoulder blades. Shoulders away from your ears. And release and relax. Take the arms to the back. Hold your upper arms. Or if possible, bring the hands in Namaste. Turn from your shoulders. Bring the hands between the shoulder blades. And sit nice and tall. And release and relax. So those were the movements from our neck and shoulders. Now we'll go on to the 8 different movements that are possible throughout the spine. So sit nice and tall. If you have a block underneath, you can remove the block. Keep your arms along the side. Lift the heart up. Reach up with the right arm. Lift the chest up. Elongate the entire right side. Lift the heart, press the left hand on the floor and traction the spine as you sway to the left. Once you are in the pose with the calm, meditative mind, you just focus on your breath. Release. We're doing the lateral flexion of the spine. Bring the right hand on the floor. Reach with the left arm. Press the hand on the floor. And then sway to the right. See if you can engage the pelvic floor, the Mula Bandha, the lower abdomen in and up. That's the Uddiyana Bandha. Engage the transverse abdominis. And lift the rib cage up. And release and relax. Inhale, lift the heart up and then exhaling, twist to the left. We're doing the axial rotation now. We did the lateral flexion on both the sides. And come back to the center, lift the rib cage and spiral to the other side. And release and relax. Now hold the right wrist with the left hand. Sit nice and tall again. Lift the heart. Exhaling, lead with your heart and fold forward. Go as far forward as you can. Once there, let go and relax there. Focus on your breath. This is the flexion of the spine. Inhale, come back, bring the hands behind, lift the chest up, look straight ahead or drop your head back and extend your spine. Elongate the waist, lift the rib cage up, open that psoas line. And release and relax. Okay, from there, we'll come into on our hands and knees, do the cat and the cow. Wrist is in line with the shoulder, knees are in line with the hips, widen your collarbones. Engage the tip and the root of the fingers. Like I said, we have bandhas around each of the joints. When you engage the opposite group of muscles around your wrist, it's called the hasta bandha. Engage the tip and the root of the fingers. Inhale, lift the chest, lift the tailbone up. We're doing the tilts with the pelvis. Exhale, tuck the tailbone in, bring the chin to the chest, separate your shoulder blade, protract your shoulder blade. Inhale, widen the collarbones, lead with your chest, lift the chest and tailbone up. Exhale, round your back, tuck the chin in. One last time. Inhale, chest and tailbone up. Exhale, separate your shoulder blade, tuck the chin in. Bring the big toes together, bring your hips back. Keep the knees separate. Reach forward and see if you can traction your spine and completely let go. If that's not possible, you can even take a block under your head. Or you can drop the block to the height that's convenient. Or if you like, you can also take a bolster or stack of the blankets and see if you can just rest there, relax, focusing on the breath. This is a very, very nice pose, child's pose. You can stay there, focusing on the breath. Again, engage your pelvic floor, lengthen the spine. And release, and take the block or the bolsters out. We'll do the puppy pose, Anahat Asana. Open the shoulders. So keep reaching with your fingertips. You can just bring the forehead to the floor if you like. Or if you want to go deeper, keep walking your fingers with arms away, open the shoulders, open the upper back, melt your heart and bring the chin to the floor. Keep lifting your hips up and back and stay there, focusing on the breath. Deep breathing. And release and come back. Tuck your toes in and sit with your knees on the floor. You can stay there for a few minutes, or you can also sit in Vajrasana. Interlace your hands in the back, squeeze the shoulder blades, lift the heart up, exhaling, bring the forehead to the floor, lift the arms up and bring your inhale, come up and release. Now we'll lie back on the floor on our backs and we'll do some stretches to open the hips and also open the hamstrings. So keep the left leg bent, reach with the right leg, grab the right big toe. If you cannot catch your big toe, interlace your hands around the thigh, or you may even take a strap onto the balls of the toes and using the strap onto the balls of the toes, engage the pelvic floor, take the lower abdomen in and up, relax the face. And once the right leg is nice and straight, see if you can stretch the left leg on the floor. Engage the Mula Bandha, the Uddiyana Bandha. The chest stays towards the chin. There is a gentle Jalandhara Bandha that causes the co-activation of opposite group of muscles around the cervical, thoracic, and lumbar spine. Gaze at the right big toe. Drishti is on the big toe. And focus is on the breath. A lot of times when our hamstrings are tight, it causes a lot of strain on the lower back. So this is really a good pose to stretch those hamstrings. If you're a runner, maybe you can do this stretch before and after your running practice. Bring the right leg on the floor, bend the left leg, reach with the left leg, grab the big toe, or you may even interlace your hands if you're not able to reach your toe, or use the strap. Once you have a nice length on the left side, reach with the right leg. You can go deeper into the pose if you can engage your pelvic floor and the lower abdominal muscles. Activate your quadriceps, which means pull the kneecap up. When you do that, the quadriceps become stronger and also the hamstrings release. Supta Hasta Padangushtasana. Release, bring the left leg down. Again, reach with the right leg. Hold the toe if you can. If you're not able to hold the toe, you can use the hand around the calf muscles or the shin. Stretch the other leg and then bring the right foot to the left and give yourself a nice twist. Inhale, bring the leg back up, and this time use the same hand. So if it's the right foot, take the right hand to the right foot. If you're not able to catch the toe, hold the leg and see if you can bring it to the same side. So bring the foot to the right. Externally rotate from the right hip joint. That will open the psoas line. Again, engage the pelvic floor and the lower abdominal muscles. Once you do that, inhale, come back to the center, release the right leg and switch the side. This time bend the left leg. Catch the left toe with the right hand, or you can hold the calf muscles, and then exhaling, bring the foot to the right and look to the left. Inhale, come back, hold the toe with the same side, stretch the leg again, take the right hand on the right thigh, and then bring the leg to the left. Keep the right leg active, keep reaching with the left leg. This is trying to open your hips in all the different directions. There's a lot of emotions and tension that we hold around our hip joint. And when we free our hip joint up, it helps with our lower back. Inhale, come back again, and release and relax. Okay, the next posture we'll be doing is Pavan Muktasan, another very good pose. Inhale, and as you exhale, bring the right hand to the right shin. Gently bring the right knee towards the right shoulder. Keep the left leg nice and straight. Keep your head rested on the floor. Relax your face and hold it there. Gently with your hand, pull the shin. At the same time, push the shin against the hand. Release, switch the side, bend the left leg, interlace your hands on the left shin, gently pull the left shin, bring the left knee towards the left shoulder, keep the right leg nice and straight. See if you can engage your throat muscles and make a sound with your throat muscles. That's the Ujjayi breath, victorious breath. And release and relax them. Hug both the knees onto the chest, interlace your hands, bring the knees close to the chest and stay there. Maybe even rock from side to side. Give your lower back a nice massage. Then open your arms in a T shape, Jathar Parivratasana. Keeping the knees together, see if you can bring the knees to the right and you look to the left. Try to keep the shoulders grounded. Use the core muscles, do it with a lot of awareness and with a lot of control. Inhaling, keeping the knees together, bring it back to the center. Exhaling, bring it to the other side. Knees to the left, look to the right. Jathar Parivratasana. Inhale, back to the center. Exhale to the other side. Again, twists are also very good for the lower back. So make sure that your practice is a complete balance of forward bend, back bend, and twist, and core strengthening exercises as well. Inhale, come back. Exhale to the other side. Inhale, bring it back to the center. Hug your knees, roll from side to side. Then rock back and forth and come up. And then we'll do a couple of standing asanas. Bring the hands to the front, tuck your toes in the back, and go into downward facing dog. So before going into downward facing dog, see if you can do a cat pose. Gaze at your navel, separate your shoulder blades, and then lift your hips up and back. This will bring you into a right alignment for the downward facing dog, and you will be looking at your navel, Nabhi Chakra. If looking at your navel is challenging, look between your legs. Release the whole spine, lift your hips up and back. Again, engage the tip and the root of the fingers, the Hasta Bandha. Pull the kneecaps up. From there, keeping the feet hip width apart, slowly walk your feet forward. Bend the knees and bring the whole spine completely relaxed onto your thighs. Bring the chest to the thighs, let go from the hips to the top of the head, completely let go. Traction your spine. And then let go of your arms. And then one vertebra at a time, slowly come up into a standing pose. So in standing pose, we'll just again do few practices to move the spine in different direction. Interlace your hands in the back, lift the heart up, engage the core, engage the pelvic floor, take the lower abdominal muscles in and up. Now bend from your hips, use the hips as a hinge. If you're not flexible, it's okay to bend the knees, and bend the knees, bring the chest to the thighs, open your shoulders, drop your head. And then slowly from there, see if you can straighten the knees little by little and go deeper into the pose. Stay there, focusing on the breath. Press your feet strongly. Inhale, come back. Now inhaling, interlace your hands behind the head. Reach up, traction the spine, bring the palms to the sky, give a nice length to the spine. Exhaling, spiral to the right. Inhale, come back. Exhale, spiral to the left. Inhale, come back. Exhale, bring the hips to the left, arms to the right. Inhale, come back, lift the heart up again, and exhale to the other side. Hips to the right, arms to the left. Inhale, come back, and release. So we'll do wide-legged forward fold. This is a good standing pose for the lower back. Separate your legs. Bring the toes in, keep the heels out. Bring the hands on the hips. Inhale, lift the chest. Exhale, from the hips you fold. So from the hips, keeping your heart up, keep a nice length, keep the legs nice and strong. When you come halfway down, you exhale, drop your head, bring the hands between the legs. And you can stay there, focusing on the breath, and see if you can bring your your head towards the floor. If that's too challenging, you can bend your knees and try to release your spine forward. Wide-legged forward fold, Prasarita Padottanasana. Engage the kneecaps if your legs are straight. After a few nice deep breaths there, inhaling, bring the hands on the hips. Exhale and then inhale, come all the way back up and back to standing pose. Okay, from there, we'll slowly go down into the sitting postures. So keep your feet hip width apart and come down to squat. Malasana, another very, very good pose to open your hips. Release your hips down. See if you can bring your heels down to the floor. The wider your legs are, the wider your feet are, the easier it is for you to release your hips. If you're flexible, you can even see if you can bring your feet together. And then if that is easy, you hold your ankles, drop your head, drop your hips, or else you can stay here, feet apart, dropping the hips, keeping the knees nice and wide. Keep the heart lifted up and stay there for a few deep breaths. And release and come down. We'll do one forward fold, Paschimottanasana. Inhale, lift the chest. If your hamstrings are very tight, you can bend the knees. This is a safer way to go into Paschimottanasana. Fold from there, bring the chest over the thighs, release your head and stay there. If that is relatively easy for you and if you're flexible, slowly work on straightening the knees so you can maintain the length in the spine. Again, engage your pelvic floor and your lower abdominal muscles in and up so that you can lengthen the spine. And as you fold forward, you can also work on strengthening your core muscles in the front, the transverse abdominis muscle and the pelvic floor. Once in the pose, focus on the breath, nice deep Ujjayi breath, victorious breath. And inhale, come back up and release. One core strengthening, Navasana, another very good pose for the lower back. Support your legs with the arms if you like. Bring the tips of the toes on the floor. Lift the heart up and sit nice and tall. That can be it for some of us. Or you can float your shin, keep supporting your legs, lift the heart up. And stay there, focusing on your breath. If you still feel strong and stable, let go of your arms, bring the arms along the side and stay there. Don't collapse in your lower back and don't slouch. Keep the heart lifted up, keep the abdominal muscles in and up, lift the pelvic floor up. If that is easy, straighten the legs, challenge yourself, point the toes, engage the quadriceps and stay there. Very, very good pose to strengthen all the core muscles and your lower back. Breath is nice and deep, Ujjayi breath, face is relaxed. And release and come down. Okay, Gomukhasana is next, another very good pose for the opening of the shoulder. If you have a lot of restriction in the mobility of your shoulder, that pain can sometimes go into the neck. And this is a beautiful pose to release that pain. Bring the arms in the back. This is the easiest version. If that is easy, bring the right hand between the shoulder blade, reach with the left arm and hold your fingers together. If that's challenging, you can take a strap and use the strap to walk your hands toward each other. Lift the heart up and look up if possible or look straight ahead. Release. We'll switch the side. Start with the left arm this time. Reach from the shoulder blade. Protract the left shoulder blade. Internally rotate the left shoulder. Bring the hand between the shoulder blade. Reach with the other arm. Gain nice length in the spine and then bring the hands to clasp your fingers. Keep the heart lifted up and stay there. If possible, lift the chest up to look up. And release and relax in Balasana. From there, we'll come into the prone position. We'll do an extension of the spine. Bhujangasana. Bring the hands by the shoulders. Elbows are in. Inhale, lift the chest and come up. Elongate the spine, elongate your waist. Don't bring the pressure on the lower back. Lift the heart up, ribcage forward and up. Press the tops of the feet, lift the heart up. Bhujangasana. And slowly come down and relax. Shalbhasana. Interlace your hands in the back, shoulders away from the ears. Inhale, lift the chest and go as much up as possible. Go forward also. Keep the spine nice and long. Shoulders away from the ears, squeeze the shoulder blades together. And exhale, come down and relax. Very good pose to strengthen the middle and the lower back muscles and strengthen the entire core. Bring the right hand under the right thigh, left hand under the left thigh. Chin is on the floor. Inhale, reach with the right leg, point the toe and lift the right leg up. Release and relax. Turn your head to one side. Switch the side, bring the chin onto the floor. Lift the left leg up, point the toe. Keep reaching with the left toe. Keep nice length in the spine and nice deep breathing. And bring the leg down, turn your head to one side and relax. Bring the hands to the side. And this is a good relaxing pose during the acute phases and flaring of the lower back pain. You can just stack your forearms onto each other, point your toes in the back, rest your forehead on the hands and then stay there relaxed. Your toes can be pointing out, heels inside, and this will nicely give nice traction to the spine. Stay there focusing on your breath. Makrasana. You can even do the Makrasana for 5 to 10 minutes in the evening if you feel tired and your back is hurting. Before you start your asana practice, it's good to do Makrasana for 5 to 10 minutes. It also forces you to do the abdominal breathing or diaphragmatic breathing, which brings in relaxation response. Okay, from there, slowly go into the child's pose, press yourselves back and relax in the child's pose. And then lie down on your back. Another last back bending posture before we do Shavasana. Bring the feet as wide as the mat. Let the knees fall in. So keeping the feet as wide as the mat and the knees a little bit fall in. Hands are pressed onto the floor. Inhale. Lift the hips to the sky. Scoop the tailbone towards the sky. Extend the whole spine. Create a lot of space in the lower back. Exhaling, slowly bring the hips down. Inhale, scoop the tailbone towards the sky, lift the hips up. Exhale, come down. Let the knees fall in. Inhaling, scoop the tailbone, lift the hips up. Exhale, slowly come down. One last time. Inhale, lift the hips up. This is another good pose to strengthen the lower back. You might feel the burning sensation in your quadriceps. Exhale, slowly come down. Bring the knees side to side. Give yourself a nice twist. Release your lower back. And then from there, separate your legs, keep the arms along the side. Close your eyes and relax in Shavasana for a couple of minutes before we do one pranayam practice, and then we can open it up to the questions and answers. So let go completely. Don't control your breath anymore. Let go of your Ujjayi breath. From the head to the toes, completely relax. Bring your awareness to the toes, the knees, and the hips, and relax your legs completely. Relax the fingers, the wrists, the elbows, and the shoulders. Release the lower back, the middle back, and your upper back. Relax the chest, relax the abdomen. Relax your face. Become a witness to your breath, observe your breath. Cultivate that breath awareness. Your breath is your connection between your body and your mind. As you learn to observe the breath becomes deeper and slower. Just become a witness to that breath. In interest of time, we'll shorten our Shavasana. It can be done for 15-20 minutes also. But now slowly wiggle your fingers, wiggle your toes, your hands, your legs. Bend your knees, hug your knees onto the chest. Roll from side to side. Roll to the right side and relax in the fetal position. So when you get up from the sleeping position, roll to one side, and then with the support, you can get up so that you don't put too much strain on your back. And then sitting in Sukhasana or in Padmasana or Ardha Padmasana, we'll do Nadi Shodhan, one pranayam practice before we conclude and open up for questions and answers. So Ujjayi breath, which is the throated breath, is the foundation of all the pranayam practices. So you will still make the sound from your throat. When you close, you'll bring the index finger and the middle finger to the third eye center. You'll use the thumb to close the right nostril. To close the left nostril, you'll use the ring finger. Begin by closing the right nostril with the thumb. The left hand is relaxed in your lap. Exhale, empty out completely through the left side. Inhale through the left. Close the left. Exhale, empty out completely through the right side. Inhale through the right. Close the right. Exhale through the left. As a beginner, we don't do any holds. As you become more proficient in your practice, slowly you can add the hold. For now, just do alternate nostril breathing. Inhale and exhale slowly and deeply at your own pace for few rounds. When you're done, interlace your hands in Linga Mudra, left thumb crossing the right thumb. Keeping the hands relaxed, shoulders wide open, spine nice and long. Bring your awareness at the third eye center and stay there for a few moments in dhyana. Your complete awareness is at the third eye center. You're not controlling your breath, you're simply observing the breath. We'll conclude with the Shanti mantra. Om Sarvesham Swastir Bhavatu. Sarvesham Shantir Bhavatu. Sarvesham Purnam Bhavatu. Sarvesham Mangalam Bhavatu. Om Shanti Shanti Shanti. Slowly, with few blinks, you can open your eyes.
Dhanyavad Hetalji.
Dhanyavad.
Namaste everyone. And before we go for our question and answer session, I would like to thank Dr. Ajaya Joshi on behalf of Seva International Hindu Samsak Sangh and Om School. Dr. Ajaya Joshi is always ready to attend our sessions, and he was with us on the January month also when we had a Surya Namaskar Yajna. So thanks for taking time and sharing your wisdom with us. Thank you, Dr. Ajaya Joshi. And definitely Dr. Hetal Naik, she is part of our family, Seva, HSS and Om School. But keep encouraging us and bringing the new speakers and sharing all yoga and encouraging all of us to practice the yoga regularly. So thank you, both of you. We can move ahead on the question and answer session. Now you all can unmute yourself and you can ask the question. I put the YouTube link where you can watch today's session in past, and I will also put the email address. If you have any question, you can write us and also know about our free yoga classes you want to join. So anyone can ask the questions here.
I think.
Hetal, do you want to read the questions on the chat?
Yeah, so there is a question from Pat. And the question is, are there any options for people having arthritis in knees and cannot bend the knees all the way? Yes, so today's practice was just an overall practice for everybody, but of course we can tailor these practices as per our needs. Always a chair is a good option to do all of these practices as well.
Hetalji, can we practice? Can you hear me?
Yes.
Okay. Can we practice the asanas which you went through today, even though if you have the backache?
Yes, the ones we went through, like, of course, we said, first you have to make sure what the cause of your back pain is, see an expert and rule out anything that we have to rule out. But if it's just a general strain that is causing back pain, all of these asanas can be done. Ajaya ji can add. Ajaya ji, if you have anything to add on that question, please add.
Agreed. Yes.
There is another question. Is today's practice also good for torticollis with the tightened neck muscles? That is from Nirvan ji. Nirav ji. So, Ajaya ji, do you want to answer that question?
Yes, I think these are great practices for that as well. So little by little, there's different etiologies for torticollis. I don't know if this is in reference to a pediatric situation, but for perception of feeling like there's tightness in the neck and maybe tilting that's muscular, these are great practices to undo and treat.
Okay. Oh, okay. Patji saying, my full name is Patanjali. That's good to know. There is someone named Patanjali.
I have a question.
Yes, please. Gauriji.
I have a neck pain and a shoulder pain right now as I'm practicing. Any specific exercises to relieve the pain? I've been having this for the past 3 days.
So what we did in the beginning, all those neck movements and the shoulder movements, those are good places to start. All of the practice today, the first half was for neck and the shoulders, but you can also do the later halves, and all of those practices will help. Have you been doing yogasanas?
Yeah, about a month now, yes.
Okay. So again, has to be learned from a teacher and do it very sincerely with a lot of effort and commitment every single day. On and off sometimes does not work. So if you do it for a long period of time and learn it properly, then it definitely will show the results, but be very patient. It takes time to show the results. But as long as you know what the diagnosis and you have seen somebody for your condition and they've made sure that there is no pathology, it's good to do all of these practices, and eventually you see you will build a lot of strength around the neck and the shoulders. So we just did few of the practices today. There is an elaborate practice for neck and back and all of that. You can do the asana practice almost for 2 hours. If you refer to different books, like say B.K.S. Iyengar, Light on Yoga, he will say for neck and head and shoulders and back pain, he'll say Sarvangasana, Shirsasan. But of course, as a beginner, we won't be able to do that. But there's a whole spectrum of exercises. You can start from these basics and then keep progressing slowly. Ajay ji, you want to add on anything that I've said here?
Agreed. So can't say it better than that.
Thank you. Those who have osteopenia and would like to do yogasan, what precautions should they take? This is okay.
Those who have low bone density, is that what you're saying?
Yes, osteopenia. Yes, Ajay ji.
Is that?
You can, yeah, that's the thing. Those who have osteopenia, yes.
Yeah. Osteopenia should not confer much of a risk, and this is not external loading, so should be okay. I think that when we get to osteoporosis, which is even more bone loss, probably best to individualize, and maybe it's less extent of a pose, so not getting to as much of an extreme. And I don't have practical experience with that, so I would value your recommendations as an experienced teacher, but I think that each situation is different. Extent of bone loss, areas of bone loss can be different. Bone loss can happen in the hips more than the spine. Sometimes the spine, by virtue of forming all of those osteophytes or bone spurs, actually becomes stiffer and more protected. So probably best to individualize the program based on the pattern of bone loss seen.
Yeah, like I've taught the seniors for 5 years, and like I said, that most of them were 65 to 80, and all of the asanas that we did today and much more, we would do all of those with them. And over the period of time, in 5 years, I have never seen any problem with any of that. So the ones that we did today are relatively very safe and can be done. Okay, so my 9-year-old has a tendency to sit in malasana for a long period of time during any floor activity, including when having meals. I was wondering if this is okay, or will it cause a long-term problem? He's now introduced to yoga, yet it seems to be natural tendency. Well, it's very good. Malasana is very, very good, right? In India, you see people sitting in malasana for hours on the bus stop, or just socializing with their friends. We did not have a sofa or a chair, which I always mention, but malasana is a good. Yeah, so but again, squatting, you want to make sure there is no heart condition which is causing the child to squat, or there is no other pathology. But if he's otherwise healthy and just prefers to sit in the malasana, that's completely fine, and it's a good practice. Did that, does that answer the question, Yamini ji? What is the effect, Selvi ji is asking, what is the effect of GABA and how to increase it with yoga practice? It is sort of an antidepressant, and also helps you with the tolerance of pain. So all of these yogic practices, they have seen that increases the GABA. Ajay ji, I'm taking the answers, but feel free to please add. And
Ajita, this is Mahesh. I was the one who asked the question.
Okay. Ajay ji, do you want to add on that?
I appreciate your answer. I don't know the details of the gabapentin release and biochemistry, if you will, but yeah, I understand it. Helps potentiate pain relief. We give it externally, and the intrinsic release from these practices is very helpful. So I agree. I just don't know more about it, so I do defer to you on that.
Okay.
Is there a natural way to increase it? Is it like through yoga, or is there anything that you'd have to take with any natural ingredients of natural Vedic food?
Well, I don't know in terms of food, but I know that all of the yogic practices, the asanas and the pranayam, do increase the GABA. Food-wise, okay. I'm not sure.
Okay. Thank you.
Hello, my name is Gauri. I'm from Houston. I have a question. I used to do yoga before for years, and then I started having lower back pain. And when I was doing physical therapy, they said I cannot do forward bend because I have a degenerative disc on my lower back. When I do forward bend, it might make it mess up. So when doing yoga, it will be hard to not to follow or do forward bend. So I stopped slowly not doing it. And once in a while, I'll go back. And I was wondering, is that a true statement? And then is there anything I can do to avoid that? And then continue on.
Yeah, Ajay ji, please answer this.
I think respectfully, I would say I don't think it's a statement that is necessarily accurate. So, therapists provide great service, and at the same time, sometimes we'll come to assessments that are different. So a patient might say, I went to therapy and my sacroiliac joint was loose, and I don't feel like I can reproduce that or appreciate that myself. Or they said that I had a leg length discrepancy, and I'll point to the x-ray and the hips are equidistant from the edge of the x-ray, the bottom edge, and the bottom edge is parallel to the floor. So by inference, there is no true difference in the length of the legs. So we just respectfully appreciate sometimes people come to a different understanding of what they see and what you can and cannot do. In your case, degenerative disc, there's no reason to not try to do forward flexion practices and asanas, in my opinion. So I think if they're tolerated, then we don't know and we don't care the extent of the degeneration if you're functionally well and tolerating it. So I would not refrain. I would try thoughtfully and slowly, gradually, and hopefully it is successful.
Thank you.
Question.
I have a question, and it relates to vertigo and feeling dizzy when you do some of these asanas. So is there anything, especially bending forward, and is there anything that can be done to avoid that?
So
Sorry Hital, go ahead.
some
I wanted to just repeat the question. I think I heard that there's vertigo induced by bending forward. Is that correct?
That's correct, yes.
do you want to answer that, Ajay? So have you ever seen anyone, and have you been diagnosed of anything with your middle ear?
And yes, this is for my wife. She's having a sore throat. She didn't ask the question, but she does have vertigo and has problems with the ear, inner ear balance.
Okay. And has she been advised to do anything in particular? My advice with this is, like, we sometimes do see the older adults having that challenge. So just moving slowly with a lot of awareness, over the period of time, I've seen that it does go away. But if there are any special recommendations the physician has made, then what was the recommendation made after the diagnosis?
She had to go through some manipulations, maneuvers to get rid of. Most of the time, she's free of the problem. But when she does bend forward, she has this issue at times, especially. So your recommendation is to move slowly and try to do this.
Right.
Okay, thank you.
Any specific asana helpful to ease tightness in lower back? That's the question. Like all of the practices that we did today, laying down on our back, stretching the hamstrings, opening the hips in different directions, that will release the lower back. So if you can go back in today's practice and see if you can do those regularly, I think that will ease the tightness in the lower back. Now the back has to be moved in all 8 directions every day: traction, lateral flexion, flexion, extension, and the rotation. And also stretching of the hamstrings is also very vital. Also strengthening the quadriceps, pulling the kneecaps so that the hamstrings release. These are some of the points that we went over. Maybe you just might want to go back and listen to it all over again, or also keep practicing the asanas that were recommended. Anything, Ajay, you want to add? think Ajay has lost the audio. Okay. I think that's pretty much all the questions from the chat.
I think somebody asked the question, when we'll have, you mentioned that we have a series on this session, when we will have the next session.
So next one is on the food, and I think it's 2 weeks from now. We'll share the flyer with all the ones that had registered for this workshop. You can also invite everyone, but 2 weeks from now on Saturday around the same time, which is what, July 4th weekend, the weekend after that.
12, okay.
Hello, Hitalji. This is Gauri again. I not just that lower back pain. I have lots of other issues with my neck and then all over the body. I was going to the rheumatologist. Because I was referred to all the pain I am having, fatigue, and then all over the body I'm having. It might be something to do with the autoimmune. Actually, after going to the rheumatologist, it was they were looking for autoimmune symptoms for years. It was undecided for a few years with all the blood work, and then finally I was told that doesn't seem like the problem. It may be something else, maybe hormonal or whatever. So every time I get flare up, I am completely down with no energy all over my body, and especially my left side from the neck. My shoulders always painful. My hip, I have done MRI, X-rays, even neuro study last time to figure out is there any nerve damage. Nothing they could find. So I'm completely clueless, and I'm figuring out what I would do in the situation. Where do I start again to figure out? I know something is wrong in my body, that I am hurting all over all the time, and I am almost like your age. And then I'm thinking I should have energy to do things, but most of the time I'm not. I was wondering, should I go for some Ayurvedic treatment, or what do I do staying here? So any suggestions? This is something maybe I can set up a separate session or call, just because I have IAG also here. So I was thinking, is that something I can look into a different direction, or I should continue with my rheumatologist or the regular doctors I'm going right now?
So Gauriji, this is a complex question. Yes, I would prefer if you can call me offline and we can just go over everything. But if Ajay has anything to add to this, please go ahead, Ajay.
And I would say similarly, I'm very happy to talk with you offline. And the goal here is not to take anyone away from medical care that they are very comfortable with. If you have a primary doctor that you like, that's great. The other part of our practice, Hill Country Lifestyle Medicine Center, is a very thoughtful, dynamic, and caring physician who's a primary care physician who has training in integrative medicine, in stress management. So I took the SMART course at Mass General. He is certified to teach the SMART course and looks at, the world in a very integrated way, mind, body, ACLM, ABLM certified, etc. So if it's of value to get a perspective, the only thing I'll say is that I've always presumed the care delivered has been thoughtful. There's no reason to think otherwise. But sometimes people aren't thinking, again, of the microbiome, right? The 300 trillion bacteria in the gut and how inflammation can arise from disrupting them, and the certain aspects of the sleep cycle, breathing exercises, and the power of breath. So there's a lot of levers to pull on still. And I would tell you and anyone that, we get it. It's challenging. It's like having migraines. It's, or worse, I don't know. So we acknowledge, and we're here to brainstorm. And, if at some point that's a separate conversation, again, in the talk, which I'm happy to have it be shared, I already passed it along to Trinabh and Trinabh Ji and Hetal Ji. So my email is there, and I'm happy to be a resource as well.
Yeah, we
Thank
will
you.
share the presentation with everyone. The same email like we sent yesterday, the presentation. Thank you, Dr. Ajay Ji.
Thank you, Amit Ji. Also, I think Amit Ji, I don't know if you're still on the call.
Yes,
He
Amit
was
Ji is
going
on
to
the
take all the questions, but I think we took it away. But there was one question I missed. For teenagers and adults who work at the desk all day and experience neck pain, how often and which stretches do you suggest? So at least few of the asanas that we went through, movement of the neck, all the ones that we did in the beginning, every 2 hours, I would say take a break and do at least 5 to 10 minutes of walking around and stretching. Cannot stress enough how important that is, with your hours and hours on the computer. It really affects our whole of the posture. So every 2 hours, take a break, do some stretching. It can be different asanas, different times. You can also try and not use the chair, but if you're on the chair, there are so many stretches that you can do on the chair itself.
I will literally tell people once an hour. I have no problem with every 2 hours, but yeah, once an hour, get up and do something. So agree in principle.
We are body full of mind.
Right?
If we keep our mind, we keep our body healthy and active, our mind stays also healthy and active. We are body full of mind. Yeah, Amit Ji, sorry, you were saying something, Amit Ji?
Yeah, I'm wondering if we can consider a lecture on the integrative medicine approach to medical care as well. It would be nice to understand the concepts of blending medical treatment from both aspects.
Sure, Amit Ji. Yes, Amit Ji. All right, I guess that is it. And then you all have our email addresses, so you can feel free to reach us out anytime afterwards also. Thank you all for joining. Thank you so much, Ajay Ji. You've been always supportive for years and years. So thank you for sharing your expertise and your time.
Thank you.
Thank you very much to you as well. Really appreciate your leadership and efforts ongoing.
Thank you. Okay, so hope to see everybody. Next workshop is interesting, food. Everybody loves to talk and hear about food. So I'm sure we'll give a lot more time for questions and answers there. Sometimes that can go on for an hour, but that's the most important thing of all the aspects of yoga. So I hope that all of you can join. That will answer a lot of questions about your food. So definitely put it on your calendar. It's 2 weeks from now on Saturday around same time. So hope to